Good morning, everyone. Thank you all for joining us. I am Stacy Carter with Pathways Senior Care Advisors, and this is actually our 7th coffee and conversation that we are doing in a series. And today, Mary and I are going to talk about the different options that are out there for people. And after about 3 years ago, when we opened our doors, we have advised many clients. Some of them have actually been the senior themselves, and a lot of them have been the caregiver, which could be the son or the daughter, or caregiver them, just a caregiver. So either way, the guidance through all this is crucial. And most of the time, people wait till they're in a crisis situation, and then they panic, and then they call us and we act fast, which is okay, but the better thing to do would be to get ahead of it. So what we want to do is try to walk you down the right path and tell you what options are out there. And then of course, as you've seen in a lot of the videos that we've done, we partner with a lot of professionals out there to help you get down that right path. But today, we're going to talk about assisted living, independent living, memory care, nursing home care, and in-home care. And then we're also going to touch on how COVID has affected some of that. Mary, I think you had a couple of weeks ago, you had to move into assisted living. Do you want to kind of talk about how that went and what you did?
Sure, I'll be happy to do that, Stacy. COVID's made it different. Typically when we have somebody call us, and in this case it was someone who was in a nursing home in rehab. They were going to be discharged from that nursing home, and their relative called to help us figure out with them the best options for this person. Well, normally we would sit down face to face and we would talk about a lot of different things. We would even maybe take the relative, since the person in rehab was not able at that point to go on a tour, but we would take the relative on a tour of a couple of different assisted living options, and we couldn't do that because of COVID. So we did a lot on the phone, several phone calls, and then they chose one particular assisted living. And how we made the move, which was a little different again than we usually do. Catherine Oliver with Moving Matters, who we turn to a lot, to move our clients from their home into assisted living or memory care. Catherine met with the relative. I also met with them at this person's home. And Catherine went through with the relative and picked out the things that would fit in this apartment. And that's what's so nice about having her, because it would have overwhelmed me to go into that house and see all of that furniture and then have to think what would really fit. And then what was a little different, Catherine went out and the way the assisted living handled this, instead of her coming in the front door with the furniture and the other belongings, she went to the door closest to that apartment, of course with a mask on, and then put everything in the apartment, set up the apartment, got all the beds made and got it all ready, looking like home. So when the person got there, they would be ready to move in and feel very much at home. And then she went out that same door. The other thing that was a little bit different is that this person had to have a COVID test before they could be moved into assisted living. And of course, right now it's getting a little bit better, but that was a couple of weeks ago. So the COVID test results took 4 days to get back. So it had to be planned ahead that the COVID test would be administered and would have the results in time to get to come back. The other thing that has changed, and it's better now than it was when COVID first reared its ugly head in this world, for a long time, the assisted livings were on lockdown completely. Nobody could see anybody. And now that's been relaxed a little bit. If you want to go see someone in assisted living, you need to call and make an appointment. And then they will have an area set up in a safe, socially distanced way. Of course, everybody wearing masks. So you can now come in and at least visit with someone, a family member or friend, a loved one that is in assisted living. So protocols do vary from senior community to senior community. So it's something else. If you need help with that, we'll be happy to let you know how the one you want to go to is working at this point in time. But anyway, it was good to see, as usual, our client be very happy with the choice they had made. They love the food in the community where they are. They were already making friends. It's a real positive change from being in rehab in a nursing home to being in an assisted living where people are happy and living a very good life. So, and Stacy, I think you also had a move, but a little bit different, into memory care. You want to talk about that?
Yes, I did. Last week, my client moved into a memory care facility here, and as Mary did, I spent numerous hours on the telephone with the son and with the daughter. And once we decided where we were going to go, of course, the client had to have a COVID test 3 days prior, so we got that all done. And in my last conversation with the daughter, she said, well, with all this COVID going on, she said, you've helped me so much. I got to meet you. Are you going to be there? And I said, well, absolutely. So what I did was I met the daughter and the sweet little lady in the parking lot at the memory care facility. Of course, we all had our mask on. And the community director came out to the car and spoke with us for a few minutes. And what we did, myself, the lady, and the daughter walked over to the courtyard area, and we sat out there. And the community director got the ladies clothes and toiletries and stuff out of the car, took those into the facility, and set her room up with her comforter on it and the things that were personal to her, while we were sitting outside talking and trying to make sure that the lady was comfortable and everything. And we did our paperwork outside and everything, which was great. So when the community director got done setting up a room, she came out and she got the sweet lady and she took her inside, and we waved at her. And as she was taking her inside, we walked around the side of the building and peeked in her room. So we were able to see how the room was all set up and what they had done. So they brought her in her room, and then there we were standing at the window. So she came over to the window and got to talk to us and wave to us. And that was a sweet moment because the daughter, was having a hard time. So we did that for a little while. And then, of course, we said our goodbyes and we left. And the daughter was a little bit teary-eyed. And I checked on her a little later that day, and she said, oh, Mom's doing great. She said, Mom's already had her nails done and had a big meal and everything. So her mother was doing just fine. It was the daughter that was, having a tougher time. But I reassured her that everything would work out. And just as Mary said, the communities are now allowing some visitation. It just has to be planned. And with memory care, if you want to visit, you could go out into the courtyard Monday through Friday for a scheduled visit and sit with your loved one for a few minutes, and then they go back in. So I know that's just a short period of time, but it means a lot just to be able to eyeball them and see them for a little bit. So the move was very special. It worked out great. It certainly is different, but it can be done. And I think it went really well.
Well, Stacy, we've talked about assisted living and memory care, but I guess we really need to talk about or define what the different options are for seniors. Because I think there's a lot of misunderstanding about it. Well, we both know. We've gotten calls over the last 3 years from people who are totally confused, or they think they know what something is, and in fact, they have a misconception of it. And I'll start out with talking about independent living. That's one that really is confusing to people. They think they're living independently in their own home, which of course they are.
Mm-hmm.
And they're living, if they wanted to downsize into an apartment, that's independent living. But in the context of elder care, independent living is really an apartment, or in some cases, it'll be a little villa that is on the campus of a licensed senior care community. So while it is independent, you're in a little safer environment. You have your own apartment. If it's a villa, you may have a parking garage. If it's not, you may have a parking space or two. You may need to contract, if you want somebody to help you with cleaning your apartment, you may have to do that yourself. And then it varies from senior community to senior community. Sometimes you have a lot of access to the amenities that are available to the assisted living residents. So you may be able to get your meals, and obviously there may be a charge for that or not, depending on which community it is. So it is truly independent, but with a little safety net. Many of them will have pull cords in the rooms in the apartments. So if you needed help, all you have to do is pull a cord, and somebody will come see what's wrong and why you need help. So independent living kind of can be the best of both worlds. Right now, there's a member of my husband's family who's in independent living. And something we'll talk about in a minute, she also has an in-home caregiver coming to her independent living unit. So there are lots of combinations of ways to put things together to make sure people get all the care that they need. So, Stacy, you want to talk about the other thing that we see a lot of confusion about, and I think it's because maybe for so long, in my life at least, there wasn't assisted living or memory care or independent living. All there was nursing home care. So many people ages, say 50 to 60 and up, that's our view of senior care, is a nursing home. And you and I both know that certainly independent living is really wonderful. It doesn't resemble nursing home care, nor does assisted living. So you want to talk a little bit about the difference in assisted living and nursing home care?
Yeah, Mary, that's a good point. We get so many people that say they don't know what we do, and when we start talking about it, they immediately say, "Oh no, you're not putting me in a nursing home." So we have to stop them and say, "No, let us kind of explain and walk through the different options." So assisted living is similar to what Mary was just talking about with independent living, except for the fact that if you are starting to have difficulty with your daily activities at home, also known as ADLs, sometimes you may hear that word. Now those ADLs are bathing, dressing, transferring, toileting, and eating. So if you have trouble with any of those, that's where assisted living is a great option, because you're free to live that independent lifestyle, but you can receive daily support, such as your housekeeping, your laundry, your medication reminders, along with, as I just mentioned, if you need help getting dressed, they can help you do that. If you need help bathing, they can help you do that. But then once you get that done, you're fine the rest of the day. So you're still kind of living independently, but you're getting that assistance as well. So that's where that comes in. And you're still getting that peace of mind to get that help, and you're not alone. It's maintenance-free lifestyle, so that means you get to take advantage of activities, events, and you get to have fun and meet all the other residents that live there and do what you want to do. So that's the difference in independent living and then assisted living. So assisted, you get some assistance, just like it says. Now for nursing home, that's a little bit different. That's for the person that either needs long-term care or skilled care. The nursing homes provide a wide range of health and personal care, but it's more focused on medical care. They may need skilled care for a short period of time. For example, let's say that grandma fell and she broke her hip and she needs rehab to get back on her feet. And then once she gets back on her feet, she leaves and, goes somewhere else, home or a different community. So that is what you're going to call skilled or short-term rehab for a little while. Now, long-term care is a little bit different. That's where someone cannot take care of themselves at all, and they might be chronically ill, and they need that support every day. That's what a nursing home does. Hope that cleared that up just a little bit. Mary, I think we've got one more, which would be memory care. Do you want to kind of talk a little bit about how that's different?
Yeah, but before I do that, Stacy, is it okay if I interject just one thing about the difference in assisted living and memory care? I mean, assisted living and medical care, excuse me.
Yeah.
And you touched on it, but it's really concerned me a little bit in the past 3 years that, and I fall in that category. I mean, I want to remain independent. I moved out of the house that I had lived in for 43 years and downsized into a home where everything is all on one floor, hoping that I can stay here most of the rest of my life. But so I get it when people are really making an effort to stay independent. But what you and I have seen over the last few years, and it's really distressing, is that in our effort to remain independent, we overdo it and don't get the support we need via in-home care or assisted living. And so we leapfrog over that into where we really didn't want to be, which is in a nursing home.
Mm-hmm.
So, I hope to encourage people to, and I know how hard it is. I haven't had to face that yet. I'm very lucky that my health is doing really well, and my husband's health is doing really well. We both still work, but I hope that I will be realistic when I do have a decline and need help, that I'll get it instead of waiting till it's too late.
Yeah.
So now I'll do what you asked me to and talk about memory care.
That's good.
Yeah, memory care is very similar to assisted living, except it's a much higher level of care, and it's for dementia and Alzheimer's patients. So in order to qualify for memory care, your family member needs to be assessed to determine if they're appropriate for that level of care. It is, I think when we go into memory care facilities, and I've got friends that are in 2 of the memory care facilities here in Bowling Green, so I see them periodically. At least I did before COVID, so that's a little bit different now. But the people who work in the memory care facilities do a wonderful job of keeping the residents' lives productive and stable. One thing we've learned is really important about dementia patients is that they have a very set routine, that things that are unusual to them are upsetting to them. So keeping them in a good routine, having activities for them to do. For example, I was at one not long ago before COVID, and it was really, really interesting to me. I sat there for about 30 minutes listening to this because the activities director said, okay, we're going to talk today about how did you learn to ride a bicycle? Well, I was astounded. People who I had been around that I knew didn't know who they were or where they were, all remembered where they had learned to ride a bicycle. And so it turned into a very active conversation, a very interactive conversation. And then one poor person said, I didn't learn how to ride a bicycle. Would somebody teach me?
Oh, that's sweet. And they're good about having conversations when they go back in time. They really, something turns on in their brain and they go back to their childhood.
They do. And I think the caregivers in those facilities are just amazing. They try to find out about them from their, one of them calls it a best friends approach. So there's a little booklet there where they found out about their life and they can talk to them about things that they used to do that they may, in fact, like you say, it may trigger a memory for them. So, and then they have, kind of fun activities, things like they play volleyball with balloons and things like that. But it's
and bingo, they play bingo.
yeah, yeah, they do. And the other part of it is they are lockdown facilities. Unlike an assisted living where you can come and go as you please, many people have a car and they go out shopping, they go to the drugstore, doing whatever they want to do, they go to church and come back. In memory care, it is a lockdown, and it's because it's dangerous for a dementia or Alzheimer's patient to come and go as they please. That's one reason they're in a memory care facility. We hear stories periodically of, my mom was on her way home and got lost and she couldn't find her way back.
Yeah.
And we heard one story about a man walking out of the house into the woods behind the house, and his wife was in a state of panic because she couldn't find him. And unfortunately, he turned up. So that's the other side of this. That when you left your client there the other day, you walked away with her daughter knowing you left her in a safe place.
Right, exactly. And as I told the daughter, I said, this is so much harder for you than it is for your mother. Your mother's going to get in there and have a good time and be okay. You're the one that is grieving and sad for what you are doing. And so she said, yeah, you're right. I can tell she's going to enjoy it. So.
Absolutely. Well, we haven't talked about the one that I bet right now, if you ask everybody between ages 40 and 55 or whatever, what kind of care they were going to have when they get older, they would say in-home care. I'm staying at home.
I'm staying home. Yeah, you're right. You're exactly right. And here's some more confusion. So let me kind of explain this. Of course, most people say, well, I'm going to stay home. That's exactly what I'm going to do. I'm going to stay home till I pass away. And that's all. That's great if you can. We'd like that. But that option is called in-home care. Now, that is different from home health care. So many people get in-home care and home health care confused. So home health is what is ordered by a doctor if you're going to go home with speech therapy, occupational therapy, or physical therapy about 3 times a week. And Medicare pays for that. So that is through home health. Now, what I'm talking about is the in-home care where you're allowed to stay home, but it's non-medical. And there's an hourly fee for that. And each company has a different fee. But as I say, non-medical, that means that they can do light housekeeping for you. They can cook, they can play cards with you, just sit and talk, chit chat, sit on the front porch and drink lemonade, just for somebody to be there, just to help with non-medical things. So that's what in-home care is. And the hours vary. You can do 3 or 4 hours a day, or you can do 24/7. But again, that is a fee, an hourly fee. And that's what a lot of people prefer. And actually, a lot of people try that first and say, I'm going to try it. And then once they get to a point where they can no longer do that because of their health declining or because of the money situation, then we talk about the next option, which might be assisted living and so forth. So that kind of explains that a little bit. So hopefully we've kind of went over these options. I know it's very confusing. Mary, do you want to add to that?
Yeah, I guess, Stacy, the reason we were motivated to do Coffee and Conversations is what I'd like to talk about just a minute, and that's the cost of care. Our,
Exactly.
our hope is that people will go. These Coffee and Conversations are going to be recorded, so we hope that they'll go and listen to them. There's some incredibly valuable information from lawyers, from people who sell Medicare supplements and so on, from financial advisors that can help you know what you need to do to be prepared. Because the one really surprise to a lot of people is all of this, with the exception of nursing home care, when you spent down all of your money and can qualify for a government assistance, all of this is private pay. So if you don't have long-term care insurance, or even if you do, you may need to supplement what the long-term care insurance pays for. And back to what you said about in-home care, while a lot of people want that, when you have an hourly rate for it, I'll let you do the math. The average is about $21 an hour. So 24/7 times 21 times 7 days a week. I'll let you come up with that number. It's a big one. And then with assisted living, you're talking about an average of around $4,000 a month, which includes all of your food most of the time. Some assisted livings have tiered levels of charges where the more care you need, the more your charges go up. Some are all inclusive. But anyway, just keeping in mind that there's going to come a day, possibly, some people are very fortunate. My mother lived on her own until she was 94 years old.
That's great.
But that's not generally true.
Yeah.
Most people are not lucky enough to do that. So being prepared for what care you may need. I mean, the good news is we're living longer. My stepfather lived to be 102 years old. When I was a little girl growing up, nobody lived to be that old.
Right,
so
right.
that's the good news. The bad news is you may need to be prepared for that eventuality,
Yeah.
and have the resources to do that. So
I know, Mary, we try to, of course, practice what we preach to people. I got long-term care insurance a couple years ago, and I do want to tell everybody that you're better to get it while you're younger because it's cheaper than waiting until you're older to try to get it. So I know it's an expense, but it's something that you definitely need to check into and see what you can afford, and go ahead and get that, and have the peace of mind that you're going to have that help when you do need it.
We're always thrilled when we ask the question, do you have long-term care insurance? And then the answer is yes. That's really always good to hear. And one of our early, I think the first Coffee and Conversation, Don Bratcher talked about, now there's a hybrid long-term care and whole life policy that you can buy together. So if you never needed the long-term care, you've got a life insurance policy. And so, because a lot of people will say, well, what if I don't ever need it? Why won't I pay all that money and I don't ever need it? Well, you buy homeowners insurance and you hope you'll never need it. But if you did need it, then having that insurance, having the peace of mind that you've got the insurance to take care of that is what's important.
Yeah, it is. It really is.
We really appreciate you all being here today. Does anybody have any questions? Okay, if not, I hope you'll watch some of our other coffee and conversations. You can reach us at pathwayssca.com. Go look at our website and see what else we have to offer, or call us anytime. We'll be happy to help. Thank you.
Thank you all so much. We appreciate it.